Hi, I'm Dr. Ron Miller with Pursuit Physiotherapy, and today we're going to go over exactly how do runners get low back pain, especially if you're middle-aged or even a college runner. How does someone who's younger get lower back pain? Running is actually a lower impact sport, so you really shouldn't be getting back pain with running, except with one case. Okay, the key with runners who have low back pain is the lack of hip extension. And I'm going to show you exactly why that is. Okay, so in order to actually run, you need 10 to 15 degrees of hip extension. That's your hip going back. And here's Keith. He's a doctoral student right now. He's going to be our model today. But let's roll over to your stomach, and I'm going to show you what hip extension is. Okay, a lot of people, because of our society where we sit a lot now, whether you're a student and you're sitting in school, whether you're working at a desk at your job, the loss of hip extension is really kind of bothering a lot of society, and especially runners. And it's the number one risk factor that I see in the clinic of why a runner would get lower back pain. Normally it's on one side if one hip's tighter than the other. If you have bilateral back pain, both hips may be tight. Okay, so what's an example of extension? Okay, this is knee flexion. This is not extension. True hip extension is when the hip comes back. Okay, and you can see here Keith has good hip extension. Okay, a lot of times people's pelvises will rotate, or I won't be able to even lift it up here. Okay, so Keith has really good hip extension here, but that's an example of the number one risk factor that I see when a runner actually has back pain. You know, even if you're an older runner and you have signs of, or MRIs of, or x-rays of degenerative disc disease or herniated disc or stenosis, it doesn't mean you always have to have back pain. Okay, remember, you can take 10 people who are asymptomatic, who do not have back pain, and they have those same findings. So just because you've been told that you have DDD of the spine or arthritis doesn't mean you have to have back pain. Normally there's some other risk factor that's involved that's causing the back pain to actually hurt, or to overload the back, or to compress the back. And the number one thing that I see in my runners who have back pain, whether it's across the whole back or on one side, is the lack of hip extension. So if you look below, there's a link where you can click on the video, and that's my favorite exercise to do at home to see if you are lacking any hip extension. And it's a great stretch to do to help relieve back pain across the low back area. So try that exercise at home. Nothing should ever increase your back pain. If you're increasing your back pain, maybe you're doing it wrong, or you have something else going on, and you may have to call us to come in for an evaluation, and we'll solve that problem for you. But just to recap, okay, running is a low impact sport. You shouldn't be having back pain with this. It's more common to have ankle, knee, and hip problems rather than a back pain. But if you're having lower back pain and you're a runner, it's not going away, take a look at the hips. The number one risk factor that I see is a lack of hip extension. You can try that stretch below. Make sure it doesn't exacerbate or increase your back pain. Try it, make sure you're feeling a good stretch, and see how much hip extension you really have. If it's not making a change, or if it's making your back pain worse, you're either doing it wrong or you have something else going on. Then I would recommend probably you have to call us. We'll get you in for a thorough assessment, and you can give us a call or a text at 407-494-8835, and we would love the opportunity to help you. Thanks.